Our partners bring so much because they are the specialists. They know their patients, they know the struggles their patients have, but they often don't have the time, the headspace and the ability to make that change alone. And actually that's where we come in to support that.
Collaboration is important for transforming the NHS because when you collaborate, you bring different types of skills to the table. And that's what's really important for us at Boehringer Ingelheim in terms of the way that we approach partnership. It's not just about a monetary exchange, it's about a skill exchange as well to try and make our partnerships and what we're delivering in that system sustainable so that the individuals and the healthcare professionals and the healthcare providers are able to sustain that change within the system for the long term.
Working with Boehringer has been really beneficial to the project. I think it's with their expertise in project management, data analytics, just knowing what data we need to collect and kind of looking at that picture as a whole and being able to analyse it and present it in a really cohesive way. I think it's been really beneficial.
What we want to do is to work with innovative partners such as Boehringer Ingelheim to do something different, to try a proof of concept, such as this post. And this opportunity has enabled us to get the expertise of Boehringer Ingelheim in terms of project management, analyses, to look at the health economic outcomes from the original phase of the results we were able to demonstrate. So having that expertise, support and project management, which are skill sets that not often exist within the NHS, or if they do exist, incredibly hard to access.
Every opportunity that we see in healthcare, we have to work out how we can do it and think outside the box. And I think working with industry is one of the ways that we will be able to achieve kind of the goals that we have shared with patients.
We were working with the Faculty of Medical Leadership and Management, Boehringer and NHS England. And the FMLM have got lots of experience in training medics for leadership. We, from NHS England perspective, knew what we needed in terms of that focus on cardiac care, and we understood some of the challenges along the pathway we were hoping to address. And Boehringer are really supportive of us working together to develop the scope and focus for the programme.
Collaborations like this enable people to come together but also develop knowledge, share that knowledge in a way that they might not have been able to do if we didn't have those collaborative agreements and partnerships.
So collaborative working in the way we're doing in this programme, but wider in our individual ICSs with our pharmaceutical colleagues, means that we can do the best for the NHS, for the patients and the country.
Working with a company that's aligned in terms of their interest on this domain is first of all really encouraging and inspiring. Secondly, just the input that Boehringer's given has allowed us to really develop this service that wouldn't have otherwise been possible.
We do meet with them twice monthly, and these are people that are clinicians by background, and they understand the system and they understand the challenges that they pose to our patients. And for me, at my level, it feels like sometimes they are an extended members of the MDT. So actually we can collaborate together. They can offer insights from their side as well from representing the Boehringer company, and we can kind of decide how we need to tweak things and how we move forward the service to best serve the patients.
When you work with a dedicated team of experts who bring skills, particularly in being able to implement pathways in the NHS and understanding large data sets and being able to provide expertise for analysis of that data and the time that as a busy clinicians we simply don't have, it has been an absolutely amazing experience.
Working with Boehringer on this project has been all good. It's been really revolutionary for me working with industry in terms of the knowledge that they bring in other aspects of patient pathways that I didn't have as much knowledge in terms of looking for solutions that we may not have thought of in the NHS.
It's been a good relationship, and the external partners as such have actually put forward ideas which we can look at. They bring a fresh eye to the position as well, in terms of they ask questions that perhaps as health professionals we wouldn't.
They have provided such great enthusiasm and drive and passion that's helped to propel from what we thought was a very small project into something that we never thought was achievable.
What Boehringer has done is really invested in this sort of foundational root and branch work so we can properly define an LC neck diagnosis.
What is good to see is that I think there's a trajectory that we are drawing out which is clear-cut with specific objectives that are coming into play. It has been very supportive, so I'm looking forward to that interaction developing and flourishing.
As we strive here in the UK to embed our vision to transform lives for generations, that's exactly what we're doing here. We are sorting out the heart failure pathway for the patients of today, but also those that are coming tomorrow, next week, next month, next year.
I think these different kinds of collaborations and partnerships and working together are really, really important to making a difference.
Our goal is always to co-create and pilot transformational yet sustainable solutions that can be applied elsewhere across the health systems, bringing further improvements to the benefit of patients.